On the morning of December 1, 1948, on Somerton Beach in Adelaide, Australia, a well-dressed man was found dead, leaning against a seawall as if he'd simply fallen asleep watching the ocean. But this was no peaceful death. Over the next 70 years, investigators would uncover a mystery so bizarre and unsettling that it has spawned countless theories involving espionage, secret codes, forbidden romance, and murder. To this day, despite modern DNA technology and exhaustive investigation, nobody knows who this man was, how he died, or why someone went to such lengths to erase every trace of his identity. The body was discovered around 6:30 a.m. by early morning beachgoers. The man appeared to be in his 40s, well-built and in excellent physical condition. He was dressed immaculately in a white shirt, red and blue tie, brown suit, and polished shoes, formal attire that seemed out of place for a beach setting. His head was resting against the seawall, one arm extended, the other lying across his body. A half-smoked cigarette rested between his collar and cheek, as if it had fallen from his lips as he died. At first glance, authorities assumed natural causes, but the autopsy revealed something far more sinister. The man's internal organs showed signs of poisoning, with congestion in multiple organs and unusual stomach contents. Most disturbing was the condition of his spleen, which was 3 times its normal size and blood engorged in a way the pathologist had never seen before. Yet despite extensive toxicology testing, no poison could be identified in his system. The medical examiner's conclusion was chilling. The man had been poisoned by an unknown substance that left no trace in standard testing. His death would have been quick, but not instant. He would have felt himself dying, known what was happening, but been unable to call for help or save himself. But the mystery of how he died paled in comparison to the question of who he was. The man carried no identification, none. No wallet, no papers, no identifying documents of any kind. Even more bizarrely, every single label had been carefully removed from his clothing. Every tag, every manufacturer's mark, every piece of information that might trace where his clothes had been purchased. Someone had gone to extraordinary lengths to make this man unidentifiable. Police checked missing persons reports across Australia and internationally. They published his photograph in newspapers. They took his fingerprints and dental records and compared them to databases around the world. Nothing. No one reported him missing. No one recognized his face. He had no dental work that matched any records. His fingerprints matched no database. It was as if this man had never officially existed. Then, investigators made the first of many bizarre discoveries that would deepen the mystery. In a secret pocket sewn into the man's pants, a pocket that wouldn't normally be found, they discovered a small piece of paper with 2 words printed on it: Tamam Shud or Tamam Shud, which are the final words of a collection of poems called the Rubaiyat of Omar Khayyam. The phrase means ended or finished in Persian. The piece of paper appeared to have been torn from a book. Police launched a search for the book it came from, and weeks later, a man came forward claiming to have found a copy of the Rubaiyat in his car on the day the body was discovered. The car had been parked near Somerton Beach, with the windows down. Someone had apparently placed the book in his car anonymously. The book was the exact edition the paper had been torn from, a rare American printing. But inside the book, investigators found something that sent chills through everyone involved in the case. On the back page, someone had written a series of letters in pencil, seemingly random. WRGOABAD, MLIAOI. WTBIMANETP MLIAOAQC. Was this a code? A cipher? Police brought in military cryptographers, code breakers, and intelligence experts. None could decipher it. To this day, despite being examined by some of the world's best cryptanalysts, the code remains unbroken. Below the letters was a phone number. Police traced it to a woman named Jessica Thompson, later revealed to be using a false name. Her real name was Joe Thompson. When questioned, Thompson denied knowing the dead man, but witnesses reported that when shown his photograph, she appeared shocked and nearly fainted. Her behavior suggested she knew exactly who he was, but refused to say. Thompson's background raised more questions. She had connections to military intelligence during World War II. She had worked in a clandestine capacity and knew how to keep secrets. Some investigators believe she and the Somerton man had been involved in espionage together, possibly as spies during or after the war. Even more disturbing were the physical similarities between Thompson's son and the Somerton man. Years later, when photographs were compared, some noted striking resemblances that suggested the Somerton man might have been the boy's biological father. Thompson took the secret to her grave, dying in 2007 without ever revealing what she knew. The investigation uncovered more bizarre details. In the months before his death, the Somerton man had been seen in the area, staying at various locations, but never registering under a name or providing identification. Witnesses reported seeing him meeting with a woman who matched Thompson's description. Others reported seeing him watching her house from a distance, as if surveilling her. A suitcase was found at Adelaide railway station that investigators believe belonged to the dead man. Inside were clothes, all with labels removed, a knife, scissors, and various items, but again, no identification. Most eerily, the suitcase contained a thread that matched thread used to repair a hole in the dead man's pocket, the same pocket where the Tamam Shud paper was hidden. The suitcase also contained a stenciling brush of a type used by military intelligence for marking classified documents and equipment. This discovery, combined with the code, the removed labels, the mysterious woman with intelligence connections, and the untraceable poison, led many investigators to conclude the Somerton man had been a spy who was murdered for reasons related to his espionage activities. But spy for whom? Australia? Britain? The Soviet Union? The late 1940s were the beginning of the Cold War. Adelaide was home to military testing facilities where British and Australian authorities were developing weapons technology. Had the Somerton man been gathering intelligence on these operations? Had he been eliminated by his own side or by enemy operatives? Another theory suggested he was involved in some kind of smuggling operation. Modern technology has been applied to the case. In 2021, researchers claimed to have identified the Somerton man through DNA analysis and genealogical research as Carl Charles Webb, an electrical engineer from Melbourne. However, this identification remains controversial, with some investigators questioning the methodology and others noting that it doesn't answer the crucial questions. Why was he poisoned? Why was his identity so carefully erased? What was the code? What was his connection to Jessica Thompson? Even if the identification is correct, the mystery deepens rather than resolves. Charles Webb had no obvious connection to espionage, no clear motive for someone to murder him, no apparent reason to be on Somerton Beach that night. If he was indeed the Somerton man, then why all the elaborate measures to conceal his identity? The case has spawned countless theories over the decades. Some believe he was a Soviet spy killed by Western intelligence. Others think he was a Western agent eliminated by the KGB. Some suggest he was involved in a romantic triangle that ended in murder.
A few even propose he was a time traveler or alien, though these theories are less credible. What makes the Tamam Shud case so enduringly disturbing isn't just the mystery itself, but the deliberate nature of the obfuscation. This wasn't a random killing. Someone carefully planned this man's death and the erasure of his identity. The poison was chosen specifically because it would be undetectable. The labels were removed to prevent tracing. The code was written in a way that couldn't be broken. Even the placement of the Tamam Shud paper seemed intentional, as if leaving a cryptic message. It is ended. Was the message for Jessica Thompson? Was it a final communication from a spy to his handler or lover? Was it meant to be found and understood by someone specific, someone who never came forward? The Somerton man lies buried in Adelaide's West Terrace Cemetery under a headstone that reads, "Here lies the unknown man who was found at Somerton Beach." His body was exhumed in 2021 for DNA testing, but even with modern science, the full truth remains elusive. 75 years later, the case continues to haunt those who study it. A man died on a beach carrying a secret so important that someone was willing to kill to protect it. He took that secret to his grave, along with his identity, his purpose, and the meaning of those cryptic letters that might be a code, a message, or simply meaningless symbols designed to mislead investigators. The final words of the Rubaiyat, Tamam Shud, "It is ended," proved prophetic. Whatever this man's story was, it ended on that beach in 1948. But the questions he left behind continue, a mystery that refuses to be solved, a puzzle that defies every attempt to piece it together. And somewhere, perhaps, someone still knows the truth and has chosen to keep it buried alongside the Somerton man.
It started as a routine emergency. Just another Saturday night in the ER. 31-year-old Gloria Ramirez arrived at Riverside General Hospital in California at 8:15 p.m. She was in the late stages of cervical cancer, and her body was shutting down. Her heart was racing dangerously fast. Her blood pressure was plummeting. She was confused, barely coherent, gasping for breath. The ER staff immediately went into action. This is what they trained for, saving lives under pressure. Dr. Julie Gorczynski and the trauma team began standard emergency procedures: oxygen, IV lines, cardiac medications. They had to stabilize her, fast. But within minutes, something impossible began to happen. Something that would turn a routine medical emergency into one of the most bizarre and terrifying incidents in modern medical history. The strange symptoms began. Nurse Susan Kane was the first to notice something odd. As she drew blood from Gloria's arm, she detected a strange smell coming from the tube, an ammonia-like odor mixed with something fruity, almost like rotting fruit. It was overpowering, chemical, wrong. She mentioned it to the others, but there was no time to investigate. Gloria was dying. They had to focus. Then Susan Kane noticed something even stranger. The blood in the syringe looked wrong. There were particles floating in it, tiny manila-colored crystals suspended in the dark red liquid. "What is that?" she asked, holding up the syringe to the light. Before anyone could answer, Susan Kane collapsed. She hit the floor hard, unconscious, before she could break her fall. The other staff members barely had time to react before respiratory therapist Maureen Welch started feeling dizzy and nauseous. She stumbled backward, trying to reach the door, and then she too collapsed. Dr. Gorczynski felt it next. A burning sensation in her face, waves of nausea washing over her. The room seemed to spin. She tried to focus, tried to stay conscious, but her legs
buckled beneath her. Across the trauma room, more staff members were going down. Some complained of burning sensations on their skin. Others felt their throats closing up. Several began vomiting violently. Within 15 minutes of Gloria Ramirez's arrival, the ER was in chaos. Medical personnel were dropping like flies around a dying patient. Emergency protocol? Evacuate. The charge nurse made a split-second decision that probably saved lives. Evacuate the entire emergency room. Staff members who were still conscious helped drag their fallen colleagues out into the parking lot. The ER was sealed off. Patients waiting for treatment were moved to other areas. A skeleton crew, working in short rotations, continued trying to save Gloria Ramirez while wearing protective gear. But it was too late for Gloria. At 8:50 p.m., just 35 minutes after her arrival, she was declared dead. In the parking lot, 23 hospital staff members were exhibiting symptoms. Some had difficulty breathing. Others couldn't stop vomiting. Several had completely lost consciousness. An ambulance had to be called to transport the sickest staff members to other hospitals for treatment. 5 people were hospitalized. Dr. Gorczynski was the worst affected. She spent 2 weeks in intensive care, suffering from hepatitis, pancreatitis, and avascular necrosis, a condition where bone tissue dies due to lack of blood supply. She was so ill that doctors weren't sure she'd survive. It took her months to recover, and she never fully regained her health.
The investigation began. What had just happened? How did one dying patient manage to poison an entire emergency room? What was in Gloria Ramirez's body that could incapacitate trained medical professionals through brief exposure? The California Department of Health Services launched an immediate investigation. Gloria's body was transported to the coroner's office, but even the coroner's staff were nervous. They conducted the autopsy in a sealed room, wearing full hazmat suits and respirators, treating Gloria's corpse like it was radioactive. But they found nothing unusual. No exotic poisons, no radiation, no biological weapons. Just a woman who died of kidney failure related to her advanced cancer. Tissue samples were sent to Lawrence Livermore National Laboratory, a facility that usually deals with nuclear weapons research. If anyone could figure out what poisoned those medical workers, it would be them. The theories. Theory 1. Mass hysteria. The official conclusion from the California Department of Health Services was simple and unsatisfying. Mass hysteria. They claimed that one person, probably Susan Cain, had a panic attack or anxiety reaction to the stress of the emergency situation. When she collapsed, it triggered a psychological chain reaction. Other staff members, already stressed and exhausted, saw their colleague fall, and their minds convinced their bodies they were sick too. The hospital staff were furious. Mass hysteria? They knew what they had experienced: the chemical smell, the crystalline particles in the blood, the burning sensations. Those weren't imaginary, those were real physical symptoms. Dr. Gorczynski especially rejected this theory. She'd spent 2 weeks in ICU. Her organs had been damaged, her bones had died. That wasn't stress or imagination, that was real, measurable injury. Theory 2. The DMSO explanation. Lawrence Livermore National Laboratory proposed a different theory, one that was scientific, detailed, and absolutely terrifying if true. They suggested Gloria Ramirez had been using dimethyl sulfoxide, DMSO, as a home remedy for her pain. DMSO is an industrial solvent that some people use as an alternative treatment for various ailments. It's absorbed through the skin and can accumulate in the body. Here's where it gets scary.
When oxygen was administered to Gloria in the ER, the DMSO in her bloodstream could have been converted to dimethylsulfone, DMSO2. Under the stress of her failing organs and the cold temperature of the trauma room, the DMSO2 might have crystallized, explaining the strange particles in her blood. But here's the kicker. When the staff drew blood and exposed it to air, the DMSO2 could have been further converted to dimethyl sulfate, a highly toxic chemical weapon-grade substance that causes exactly the symptoms the hospital staff experienced: respiratory distress, burning sensations, loss of consciousness, and organ damage. In other words, the medical team might have accidentally created a toxic chemical weapon while trying to save Gloria's life. Her body had become a chemistry lab, producing poison from everyday materials. It sounds like science fiction, but the lab ran the numbers and the chemistry checked out. It was theoretically possible. Theory 3. Illegal drug lab contamination. Some investigators suggested Gloria Ramirez might have been exposed to chemicals from an illegal methamphetamine lab. The Riverside area had problems with meth production in the 1990s. Maybe she'd been exposed to toxic chemicals that accumulated in her tissues and were released when she was stressed and dying. But this theory had problems too. Why would only her blood be toxic? Why weren't her family members who cared for her at home affected? Theory 4. Environmental contaminants. Could something in the hospital itself have caused the illnesses? A gas leak? Contaminated air conditioning? Pesticides? Investigators checked everything: air quality, water supply, cleaning chemicals, ventilation systems. They found nothing unusual. And if it was an environmental issue, why did it only affect people in close proximity to Gloria Ramirez? Theory 5. Cover-up.
The darkest theory? Maybe Gloria had been exposed to something classified or illegal, and authorities didn't want the real cause made public. Maybe she'd stumbled into a toxic waste site or been exposed to experimental chemicals, and someone was covering it up. This theory gained traction because of how quickly authorities settled on the mass hysteria explanation without thoroughly investigating alternatives. The unanswered questions. What was the smell? Multiple witnesses described the same ammonia fruit chemical odor. That's not mass hysteria. That's not imagined. Something was producing that smell. What were the particles in the blood? Susan Kane and others saw crystalline particles floating in Gloria's blood. Laboratory analysis confirmed the blood samples showed unusual characteristics. But what were those crystals? Why did Dr. Gorczynski suffer such severe injuries? She had measurable, documented organ damage. Her bones died. That's not psychological. Something physically harmed her. Why did symptoms correlate with proximity? People closest to Gloria got sickest. People farther away had milder symptoms. People outside the room were fine. That's the pattern of chemical exposure, not mass hysteria. What happened to the blood samples? Some of the blood samples drawn from Gloria disappeared or were destroyed. Why? What happened to that evidence? The aftermath. Gloria Ramirez was buried, but her family always felt she'd been blamed for something that wasn't her fault. They insisted she never used DMSO or any unusual home remedies. She was just a sick woman who went to the hospital for help. The hospital staff who were affected that night never fully recovered. Some had permanent health issues. Dr. Gorczynski's career was effectively ended. She could never work the same demanding ER shifts again. Riverside General Hospital was sued multiple times. The hospital eventually settled, but never admitted any wrongdoing. The case was officially closed with no definitive explanation. A legacy.
Today, the Toxic Lady case is studied in medical schools, forensic science programs, and toxicology courses. It's listed as one of the most unusual and unexplained medical mysteries of the modern era. Some believe the DMSO theory. Others think there was a cover-up. Many still believe it was just an unfortunate case of mass hysteria amplified by media attention. But those who were there that night, the doctors, nurses, and medical staff who collapsed, who felt their lungs burning, who watched their colleagues fall unconscious, they know what they experienced was real. And they know that somewhere, somehow, Gloria Ramirez's body became toxic enough to poison everyone who tried to save her life. The question that haunts them isn't whether it happened. They know it did. The question is, why? The warning. Gloria Ramirez's case reminds us how much we still don't understand about chemistry, biology, and the human body. It reminds us that sometimes, under the right circumstances, ordinary materials can become extraordinarily dangerous. It reminds us that we're all walking chemistry labs, and sometimes the reactions inside us can produce something unexpected, something deadly. And it reminds us that even in our modern scientific age, there are still mysteries we cannot solve. Somewhere in a file cabinet, the complete records of what happened that night in Riverside General Hospital still exist. The blood samples that survived, the medical reports, the toxicology results. Maybe someday someone will take another look, use new technology, find the answer. Until then, Gloria Ramirez remains the toxic lady, the woman whose body became a weapon, whose death poisoned the people trying to save her life, and whose mystery remains unsolved 30 years later.